Okay, hey everybody, we're here for another episode of the Melillo Method podcast, Everything Brain. I'm here again with my partner in crime, Dr. Peter Scire. I'm Dr. Robert Melillo, and we've been, bringing you along, really looking at the brain and neuroscience. What we want to do really today is talk about one of the biggest issues that we find in the healthcare system and the healthcare model, and I think that frustrates patients and parents and families is how divided the healthcare system is and how they try to break the body into these separate individual pieces. And there's very little integration. And that's not the way it works. It's really all one integrated system, really under the brain. But that's not the way that it's approached in traditional medicine. I remember one of the famous quotes from George Bernard Shaw that I heard was that he was saying, and this was in the earlier 20th century, you're saying doctors are becoming more and more specialized so that each year they know more and more about less and less. And at some point, they're going to know so much that they'll know everything about nothing. I think that's what we see. And I was just discussing that with some patients today, and we were talking about that, and we thought it'd be a good idea to bring this perspective in here into our audience.
Yeah. I mean, in the childhood development arena, you have people that are in the behavioralist camp. You have people that just look at these brain disorders as problems in neurotransmitters, and all you need to do is medicate a child. Then you have the people that are in the physical rehabilitation model, the space that we tend to be in, but we've expanded it out. And then you have the people that are in the biomed model, that think everything is all about heavy metals and toxicity and all the different.
It all starts with the gut.
And and then you get into the functional medicine piece where everything starts in the gut. And so where we've always stepped back and said, how does it all relate to the brain? As brain controlling everything. And so I think that's where we need to discuss everything today.
Yeah, and we can talk about it in terms of right brain, left brain. We can channel Ian McGilchrist and look at it. We are both right brain dominant people, so we look at the big picture, and we look at it as all we can't break it up. It's like you can't see it separately. You can only see it as one thing, really, because that's what it is. But the left brain model and the left brain world breaks everything up into pieces and breaks it down and analyzes it, and it's all separate individual pieces that work separately. And we know that, as he talks about, that Western civilization and the development of medicine and traditional Western science and traditional education, psychology, psychotherapy is all being more and more broken down into this left brain world of looking at everything as separate pieces and not looking at anything as integrated. And as he talks about, like with art, when you take something that is whole and beautiful and you break it down into and try to always analyze the pieces, you literally ruin it.
Yeah.
And I think in healthcare, the old-time doctors, they did everything. You had the doctor that just treated everybody or everything. You look at chiropractic. Chiropractic was founded on that. It's a holistic healthcare model that the nervous system and the brain and its relationship to the spine and posture was related to overall health.
Yeah.
And that was, osteopaths had the same mentality and magnetic healers had that mentality. And that was the way that medicine was when they didn't have really medical schools or they weren't really adding that whole left brain. And then it became so left brain that unless you were a 100% straight A student that got, A's in 4.0 through every year of your life, there was no way you were getting in medical school. I mean, when I was, in college, there was no way. If you had one B in your life, you were never getting into medical school.
Yeah.
So it was just feeding into this left brain mentality and attracting more and more left brain dominant people and getting away from any sort of right brain medicine or understanding. And as we see that, medicine became more and more and more specialized. Bedside manner became less important, interacting with people and and then that got translated into the insurance companies and how they pay for it and what they feel is valuable or not. And, and that is where we are now. So we can look at it from this whole right brain, left brain mentality and the way that our society is moving towards the left brain. And this is, part of the problem. We want to bring it back to the right.
And one of the things I see all the time is that many of the camps that we see in the childhood development arena, especially in the functional medicine world, is, some of these people that started these camps are the parents of the children. And, what about the emphasis of their left brain traits that, again, yes, these are medical physicians that probably have left brain dominancy. Okay, so now they grasp onto this one particular piece, and that's their expertise now, and everything revolves around that particular piece in the puzzle of autism and stuff, as opposed to, again, being able to take this holistic approach and this right brain approach and saying, okay, how does it all make sense? And I think that was the thing the first time I ever heard you speak, and I was like, okay, all right, this is a man who's talking about all these different parts, but how are they all interconnected too? And I think that's the challenging thing, because in the world of where we are today, where everything is being brought to us in little bits, okay, these little bits of reels and Instagram or TikTok or whatever. I think the confusion for these parents is at an all-time high, and to be honest, they don't know who to believe, and they're getting all this information, and from one week to the next, you can see the algorithms and saying, okay, well, they're pushing this particular topic on Instagram about autism or ADHD or that. And I look at it and I'm like, I'm always sending you videos and saying, okay, look at this nonsense today.
Yeah.
Okay. But no one is literally telling them the real truth and saying, okay, no, this is ultimately the problem. And everything that you're seeing over here and they're talking about are just downstream relationships to ultimately the imbalance.
Yeah. Yeah. It's like, talk about the left brain and how the left brain lives in an echo chamber, and it just is repeating what it already knows, and it wants to hear what it already knows. It doesn't want to really hear anything new or anything outside of that. And so, anything that reinforces what it already believes, it is drawn to and reinforces. Anything that takes it away from that is immediately discounted or even attacked negatively. You sent me a video. I was watching it of this kid on the autism spectrum and whatever. And one of the things he said, just kind of matter-of-factly, he said, autism is 80% genetic, so there's nothing you can do about it anyway. And some paper came up real quickly, circling 80%. And I'm like, where does that statistic come from? That's completely untrue.
Yep.
And yet it's being thrown out there as a fact, not being questioned in any way. And of course, what does that actually mean, being genetic? Yeah. They don't even understand what the meaning means, right? If you're talking about that it runs in families, that's not a genetic disorder. So
and don't even get me started on those people that throw up those little, blips of an abstract and, in their back reel. I'm like, did you even read the whole damn paper?
Right.
Okay.
Yeah.
Did you even get into the data and actually understand the paper? And so, it's very frustrating, because I think that, we've been doing this for a long time. And, I definitely get the sense that these younger parents that are 35 and younger, that are this generation of social media, the iPhone generation, they're more confused than ever. Yes. They just don't know who to believe.
Yeah.
Okay. And, they want to believe us, and they want to, but then they're like, well, but what about this? What about if I heard that, from practitioners that if you don't address the gut first, you can't fix the brain. I'm like, where'd that come from?
Yeah. From people that don't know the brain.
Exactly.
But yeah, and that's the thing, the whole idea even of the movement towards evidence-based. And listen, we're all about integrating the brain. We're not about one side or the other. We're about that things need to be integrated. So I've worked my whole career to build my left brain and work my left brain to work with it, so that I've created the research and the evidence. And I understand the value of that. And we talk about that all the time. But, the right brain doesn't need empirical evidence. Mm-hmm. The right brain, people that are very right brain dominant are intuitive, and they just know, they know this feels right to me. Mm-hmm. I know this is right, and I know what you're saying is right. I get it instantly. I figured it. I've already put this together. The left brain wants, well, where are the facts? Where are the details that prove that? And so, that's where it can get confusing, because even though intuitively, they may say, this feels right to me, this type of treatment, and this type of treatment doesn't feel right at all. But yet this is evidence-based, and it's got, these papers, and it's got these empirical peer-reviewed papers, and, and so therefore this is where I need to go. And this is only what my insurance company will pay for, because this has evidence. And I appreciate that. But,
Sure.
Going into that world and driving it that way, again, doesn't really make it better. And, we know that the way that the research is based is also, when you say something's evidence-based, I mean, most medication out there, I think it's something like 80% of medications, especially in the behavioral world, in the kid world, that almost all of the medication is off-label use, which means that it went through FDA trials for a particular use, and it could be, let's say, blood pressure, and now it's being used for ADHD, and it's never been studied in ADHD. Yeah. But now what people will say is, well, this is evidence-based because it's medicine and it has been actually approved, but it wasn't approved for ADHD. So it's not evidence-based, but it's being used that way. So, and that's most of the medication that's being used in children today. And so therefore, really none of that is actually evidence-based, but people don't know that. And so not that we shouldn't look for evidence-based treatments, but when they say, well, this is evidence-based and that's not, well, none of it is really evidence-based. So, now we're a little bit on more equal footing, but, let's look at the rationale that's underneath it. Let's look at what we're trying to do, and let's look at the results. And so why don't we pull up, guys, Gabe, Brendan, the first slide here. So just exactly what you were talking about. Let's talk about the landscape of what's out there. And we've been talking about this for a long time. And I created this slide years ago for this very reason, to be able to highlight and bring a right brain picture perspective into this. So there was an old Indian fable called The Six Blind Men and the Elephant. And the way the fable goes is that there were there's a village in India, and there were these 6 blind men that lived there, and they'd always heard stories of the mighty elephant and how, majestic it was and everything. But being blind, they had never actually seen a elephant, but they wanted someone to bring them out to an elephant so they could touch it and feel it and examine it, so they could really start to understand what an elephant was like. So they jumped in a vehicle, and somebody took them out, and they brought them to the elephant. And they all got out of the cart, and they all wandered out, and they went up to the elephant, and they touched the elephant. And each one of them grabbed a different part of the elephant. So one grabbed the spear. One grabbed the tusk and said, oh, an elephant looks like a spear. Another one grabbed the trunk and said, an elephant looks like a snake. Another one grabbed the leg and said, it looks like a tree. The one grabbed the tail and said, it looks like a rope. Another one touched the side and said, wow, an elephant's like a wall. Another one grabbed the ear and said, wow, an elephant's like a fan. And so once they had done that, they now were convinced that they absolutely know what an elephant looked like. And they went back to their village, and they sat down and started to talk about what an elephant was like. And then they got into this terrible argument about what an elephant looked like, because all of them had a completely different opinion, and they were absolutely sure that they were right and that everybody else was wrong, because they had their own evidence, because they had touched it. And what they didn't realize, and what they never talked about amongst one another, is that maybe they were all right and they never saw the whole elephant. And they could only focus on the one piece. Okay, guys, can we go to the next slide? Great. Okay. So when, parents take their kids out, or a patient goes out, and they're going to all these different specialists. And that's the thing, is we have all these different specialized people that focus primarily on one area. they may go out and people say, well, this is purely a psychological or educational problem. That, that's it. And, they don't really know about the body. They don't know about the motor system. They don't know about, the immune system, digestive system. They may not understand really the nervous system at all. They don't understand anything about brain development. And then other people will say, no, this is a hormone imbalance, and that's the problem. It's an endocrine problem. Other people will say, no, this is all biochemical. It has to do with toxins. It starts with the gut. It starts with inflammation, vitamin, mineral deficiencies, no digestive enzymes, all of those types of things. Other people will say, well, it's really purely a motor problem or a sensory problem where it's a sensory integration issue and it's an auditory processing deficit or it's a visual processing problem. Other people say, no, this is purely immunological and it's all neuroimmune and it's inflammation in the body and it's related to food sensitivities or it's related to chronic infections or other types of things like that. And other people may say, well, it's really, again, a gut problem. It's an autonomic problem. It has to do with the sympathetic, parasympathetic. And all of them are right. And all of them are completely biased because they only see that. And they only know that. And they believe that that is it. And they may even believe that that's the root cause. But they don't step back and realize that it's all the brain. And it all has to do with the balance within the brain and the hemispheres and the networks and how the brain and nervous system regulates all of those other systems. And it's one integrated system, and the head of the system is the brain, and each hemisphere regulates it in very specific and different ways. And how it gets to the point where it regulates things properly is all based on how that brain develops, which is driven by the motor system and the sensory system, and then plays a role in the maturity and the development of the gut and the autonomic system and the balance of the sympathetic and parasympathetic and, whether there's inflammation and whether there's food sensitivity and, whether cognitive things are literally emerging like attention and how we learn and how we remember things. And, the emotional regulation is all regulated by that. So this is an analogy of that. And all of this is influenced by the environment and it's all influenced by genetics because they're traits. But all of that is what we look at as epigenetics. And so in almost very few cases, is it because of a genetic mutation or because of an actual injury to the system or because of a neglect or abuse or, something terrible like that? Most of the time, these kids are raised in great families with great parents and they don't have genetic mutations and they don't have any brain injury. And these are why we refer to them as functional. Yeah. And this is where functional medicine and functional neurology, but even those people in those fields are very limited because they may not know that other field. Functional neurology may know the brain and neurology, but not really understand the biochemistry or the immunology that way. And people in the biomedical world typically know nothing about the brain and the nervous system whatsoever.
And one of the challenging parts for our families is that they'll end up spending years jumping from one area, okay? And, usually they may end up at the pediatrician, and for the initial potential diagnostic workup, then the pediatrician may say, okay, well, I want you to go see the occupational therapist, or I want you to go see the speech language pathologist, or we're going to refer you to a physical therapist, okay? Then the child goes to...
And meanwhile, they don't know what any one of those people actually do.
Yeah.
You know what I mean? Because they've never done it and they've never been trained in it. So, not that they're doing it in a negative way, but they really don't know what they do. They don't really have
No, they're just
idea.
checking a box
right.
in the algorithm of the insurance arena to say, okay, hey, refer to this person, okay? You have, and to be honest is that, did the general pediatrician even do a pediatric exam on the child, okay? Or are they just purely going off a symptom-based relationship, okay? Maybe at best may have them fill out some levels, some questionnaires, but for the most part, it's just going to be a 5-minute interview to say, okay, well, Dr. Jeff over here says the mom tells him these symptoms and go, okay, it sounds like it's ADHD to me, okay, or it sounds like that might be autism. Okay, well, I know the algorithm tells me to send you here, okay, so I send you here, and I go to these people. But then now the child develops, and let's say now the child enters pre-K or kindergarten. Well, that's where the neuropsych or the neuroeducational community is going to come into play. So now we may get some type of neuroacademic assessment on the child. And again, prior to the age of social media, you would have maybe said, okay, well, I heard about this biochemical group of people that are looking at toxins and looking at food additives and stuff like that. Okay, so now the parent goes down that rabbit hole. All right. And then that maybe leads them to some of the early pioneers in functional medicine that said, oh, no, this has got to do with an immunological stuff. And it's the relationship of gluten, and your child's reacting to the gluten protein or dairy protein or other food proteins. Okay. And then we start seeing them having these different displays in their central nervous system and their sympathetic dominancy and their fight or flight responses. But nowhere along the way in that conversation did someone say, do you want to start looking at the brain and starting where we would start and go, okay, is the brain immature? And the easiest way we're going to figure out the brain's immature is first look for, does the child have retained primitive reflexes?
Right. And, that's the thing of all of it. And we talk about that immunology is complex. Yep. And without a doubt, not taking anything away from it. But the most complex thing is to understand really the way the brain operates and functions moment to moment. Mm-hmm. And very few people have a really good working knowledge of the brain and functional neuroscience. And that's where this all falls apart, because many of them have, neuropsychologists, first of all, I have a degree in neuropsychology. I have a master's in clinical rehabilitation neuropsychology. I've been trained in all the testing. And neuropsychology really developed for testing, not for treatment.
Yeah.
And really doesn't do that. And psychology, most people don't realize that most psychology programs don't even have one course in neuroanatomy. Like they literally learn nothing about the brain. Even the traditional neurologist knows about the brain, but doesn't really know like intricate functions of the brain itself. They really look at it as clinical neurology, meaning this is what I do, these are the symptoms, this is what I do to treat it.
And again, they're looking for lesions. They're looking for hard lesions. They're not looking for, they're looking for some type of tissue that's been damaged.
Right.
Okay, either through an injury or most likely some tumor.
Right.
Okay, or a vascular event.
They're as you said, they're literally looking for an anatomical genetic lesion of some sort. And if it's not there, then they don't know what to do about it, right? So this is where I think that the biggest gap is in the brain and the nervous system. And because people don't know that, they just, like most of us, we avoid what we're not good at. And people don't understand, like you're asking, like a patient will say, we may recommend certain vitamins or certain supplements or look at food sensitivities. Even the difference between what's a food allergy versus a food sensitivity. People will come in and go, yeah, my doctor checked for a food allergy.
Food intolerance too.
Right.
Yeah.
So, check for food allergy. Mm-hmm. Okay. He doesn't have any. Yeah. Did they check for food intolerances or food sensitivities? I don't know. I think they did. Wouldn't they do that? No, they wouldn't do that. If they went to a traditional allergist, they may only just look for an allergy, and that's IgE. Yep. It's a whole different antibody. It's a whole different animal.
Yeah.
And just because, they don't have a food allergy doesn't mean they don't have a food sensitivity, and doesn't mean it's not important. Or they say, well, wouldn't my doctor prescribe this vitamin? Most MDs get something like 4 hours of nutrition in medical school. They literally know nothing about it.
Yeah, and it's not even just, I would say, the MD community, but even you look at, 4 years in chiropractic college. We didn't have a great most of my education in functional medicine, functional nutrition, and definitely all my education in neuroimmunology has come postgraduate.
Yeah.
I had one 3-hour class in immunology as just and there's an elective class too in my 4-year doctorate. Now you got sprinkled some immunology in your pathology classes and
Right.
stuff like that, but you never had, a tremendous amount. And so, and the same thing goes in medicine. And so and then in the classic model of neurology, how I know you learned it, and again, me being the second generation of functional neurology group, is we learned it in a very lobular way. We learned it in a very, hey, this distinct area of the brain does this. Now, granted, that was the evidence of the science then, okay? But now we're talking systems neurology, okay?
Right.
And the idea that we're really not saying, okay, hey, this one area of the brain, like the parietal lobe or the occipital lobe, we're talking about how are they communicating to each other in a simultaneous way, and that we're getting these neural networks in the brain.
Yeah.
And that's a whole different ballgame. And that's a whole different way of treating it. In the early classic ways that you learned neurology and the way I learned neurology in terms of an application of treatment was, okay, identify where the soft lesion was, not the hard lesion, but the soft lesion of functional inability, and you would treat into that area. But we weren't treating in the networks like we are now. And that's the evolution of where you've gone with your work in the Melillo method.
Yeah, and it was more, again, kind of looking for a singular lesion or a singular problem. And it was really more, again, kind of dealing with, like you said, not really dealing with it as a whole integrated system, not really understanding that. And even in functional neurology in the beginning, we didn't really have anything that really looked at immunology or any of that really well, or even how the autonomic system was really controlled appropriately. It wasn't really till Datis came in and brought that into the functional neurology world, where he started talking about, looking at that and trying to integrate it together, that became a part. And now, we're looking to bring it at a whole different level, with Sam also brought that in obviously as well.
Yeah, and in the functional medicine world, unfortunately, and to this day, is that the majority of practitioners do functional medicine do not do functional exams. Whether it's a functional neurology exam
or just explain what a functional exam means,
or just a basic, exam of a patient, okay, where you would actually do a bedside exam of a patient, okay, and that bedside exam being, hey, I'm going to do a sensory exam, I'm going to do a motor exam, I may do a cardiac, workup or a pulmonary workup on that patient, okay. People that are out there saying, oh, I treat thyroid, and they don't even actually do a thyroid exam. Okay. And this is something that, again, you bring up our colleague, Dr. Karazian. This is, I just completed his postdoc program, and that was a big thing for him, was that, okay, you got to do a clinical exam on a patient. Okay. So how many these families that are going to clinicians that are not doing a clinical exam? Okay. They're running some fancy biomed tests that some lab came up with, and then found some docs to say, oh, okay, hey, we want you to go out here and teach these webinars, and we're going to sell all these labs. But no one's putting it in the context of a systems and looking at systems biology.
And in a virtual medicine world, it's even worse than ever.
Yeah.
Because we're moving towards, and we think that this is actually, the ideal situation. Like, this is a great evolution that we have telemedicine.
Yeah.
And there's some advantages to that, but nobody is getting an actual physical exam.
Yeah.
And a physical exam means that, how do you check the reflexes? How do you check muscle tone? How do you look at the pupils? How do you know if somebody has a sense of smell? How do you know what they're
blood
hearing?
Pressure, you're checking
the blood
pulse
pressure,
rates,
again, looking for things like primitive reflexes.
Yeah.
You need to actually, and I tell parents this, and I say all the time, your child got a diagnosis. Did they explain what that means as far as what's happening in their brain? They're like, no. It's like, did they ever even touch your child? No.
Yeah.
Child was in there. They observed, maybe even in another room through a glass window. They observed and they said, okay, this is the diagnosis. This is autism. This is ADHD. This is whatever.
Yeah, they look for the stim behavior. They look for the echolalia, the palalia. They look for those symptoms, the functional symptoms that they see, but not about doing an examination on a child or a young adult.
Yeah, and really to do it properly, you need to do it. Really, ideally, there is a physical examination component of it. And, as good as virtual and telemedicine may be, that it'll never replace that
Yeah.
to a certain extent. Unless someday we get a tricorder, like in Star Trek, where we can just run it over a person and
Yeah.
all of these vitals pop up. But even then, you're still not going to be able to look at muscle tone.
Yeah.
You're not going to be able to look at, other things like, are these primitive reflexes there, or what does their coordinative skill look like, or is there asymmetry? So there does need to be a physical exam almost at all time, like you're saying, and it should also be coupled with functional measurements, measuring, documenting functions in each one of these systems. Because the thing about that slide is it does represent there are different systems.
Mm-hmm.
And everybody's impact on those systems might be different.
Yeah.
And all of them are involved or may be involved and play a role. And all of them need to be examined, they need to be functionally measured, and they may need to be addressed separately. But ultimately, none of them alone are the root cause.
Yeah.
None of them. And so what the idea is to get to the root cause. And this is where, we hear this all the time. And we just had a conversation in my office with a psychiatrist, and we were working with her daughter who was struggling with something called depersonalization syndrome. Tremendously talented artist. I mean, really, maybe one of the best artists in the world. And as we say all the time, the people that end up with imbalances are those that are often the most gifted.
Mm-hmm.
And, she was saying how now that she's in the office and we're working with her and we're helping her daughter tremendously in just a couple of months, and she'd been getting treated and been on medication for years. And she said, I'm a psychiatrist and I can help people a lot. I can prescribe them medication and I can talk to them and I can prescribe other things for them. But she said, as you're going through with my daughter and listening to your explanation and reading your book and now taking our course, she said, I realized that, of course, we're not getting to the root medication at all. We're not getting to the root cause at all. We're not addressing it. Mm-hmm. And medication will never get to the root cause. So although it's helpful and it plays a role, we're not actually getting to really what the problem is. Mm-hmm. And that's the point.
Yeah.
And when you're only looking at one part of the problem, then you're obviously not getting to the root problem. The root problem is what would explain all of these systems being involved? Why would the neuropsychology, or why would cognitive issues or learning issues or attention issues or emotional issues be associated with eczema and immune issues and autoimmunity and food issues, or problems with constipation or diarrhea, or having malabsorption type of problems? Or why would it be associated with low tone or tics or movement disorders? Why would it be associated with abnormal sensory stimulation or feeling things? Or why would all those things go together? Well, there's only one system that rules them all, and that's the brain. So I always tell people, whenever you see multiple systems involved, it has to be the brain.
Yeah.
It's the only thing.
Yeah.
That has to be the root. Because otherwise, you could have maybe just one pure pituitary tumor that gives you a hormone problem. And yes, it's going to impact other systems, but the problem is the hormone problem. Mm-hmm. Or you may have, a person eats terribly and really, or, doesn't get vitamin C and ends up with with a really serious problem. There can be individual systems that are impacted in individual ways. But when you're seeing multiple systems really impacted, and it all relates to, something that we see, especially when it manifests in neurological symptoms, then we know that the brain is the primary driver.
And when we see them go to these different providers, but then we take on the case and we can go, okay, well, even when I'm doing consultations and parents will go, well, we went to so-and-so provider and they did this. And so what were some of their findings? And they go, well, they determined that maybe they had some sensory integration stuff going on, or they may had some balance stuff going on, or maybe they detected potentially some imbalances in the vestibular system or the postural system. And, oh, yeah, we went over here to the psychologist, or we went over to the school psychologist, and they did a test. I said, oh, do you have the test? Oh, yeah, well, great. Yeah, we have it. So send it over to me. And then here you are, be able to take that information they had there on the sensory stuff. You take that information from the cognitive stuff. You take in their behavioral symptoms, or their social delays, or their cognitive delays, and then you can explain it in the context of an imbalance.
And, and that's the thing. All of those specialists that we talked about are going to come up with a separate diagnosis.
Yeah.
So now they're only looking at one part of the system and they're giving you a diagnosis. So now a person's going to have multiple diagnoses.
Yeah.
And that even adds to the confusion. Yeah. And then the person believes, oh my God, I am screwed. I have all of these things wrong with me. I have all these lists of diagnoses. And then we even get some people to come in and say, nobody can fix me. Yeah. Nobody. I'm so far gone.
Yeah.
I have 10 diagnoses. Yeah. Can you help 10? Yeah, because it's really one, Well,
the best is when they come in and they say, hey, my child's got ADHD and he's dyslexic. And I said, well, that can't be happening.
Right, exactly.
Okay. Like, what do you mean? I'm like, one of them is wrong.
Yeah.
Okay. Somebody got it wrong.
Right.
Right? Because it's impossible.
Right.
Okay. Your child can maybe have, if they have a problem in phonics and phonemic awareness, and they have low vocabulary skills, and they're a poor speller. And I just did this with a case a couple weeks ago where the mom was insisting that her child had ADHD. And I'm like, no, I don't think it's ADHD. I honestly think your child actually has a bona fide learning disability. Okay. And, when we went through your hemispheric checklist, and I listened to the history of the case, and I said, well, send me any academic stuff that you have. And they didn't have a Wyatt, but they had some of these different state tests and everything. And I looked at them, and I looked at several years of them. I'm like, there is no doubt that this child has a learning disability. Said now, they may have an attentional problem, okay, but it could be because of the slower processing speed of the left side of the brain, like we've discussed on other podcasts, where we've talked about the processing speed of the visual system and the auditory system, and how that may play a role in the ability to have attention, but not hyperactive and impulsiveness. And if anything, they probably had just more of this higher right brain function, and where they were paying more attention to their environment in the classroom and not being able to have the one true attention of the left brain being the focal attention.
Right. Yeah, they have the open, broad attention, but they have too much of it.
Yeah.
So it's too open and too broad. And they're social, and they want to be with people, and they want to play with their friends, and they want to be outside running around because they're physical and they're spatial, and they hate doing the same thing over and over, and they hate sitting so they want to move. They're energetic. They're active.
And they have that they're daydreaming, so they may have that higher salience.
Exactly.
Network.
Or default mode network.
Default
so
network,
they look like they have an attention problem. And it even may be labeled with type 1 ADHD. But even then, people come in and say to me, my child's been diagnosed with ADHD. And I said, what type? What do you mean what type? Well, there's 3 different types.
Yeah.
Oh, they didn't say that.
Yeah.
I remember I had a while back, perfect example of this. One of the psychologists that we know from Harvard that was up there at McLean Hospital, Leslie. And he was, well-known psychologist, part of that Harvard McLean Hospital lab, and a very bright guy, part of a lot of different papers, great researcher. And he called me one time, and I was literally stepping on stage to about to do a lecture, and he called me. And he said, we have to do your work for adults. I said, well, I do it for adults, but I said, but why are you saying that? He said, I had this kid that was sent to me by some colleagues who couldn't help him. And he said, this kid comes in, and he says to me, that show, The Big Bang Theory? I said, yeah. He goes, no, Sheldon Cooper. And I said, yeah. He said, it's him, right? So classically that Asperger's type of personality type. Really high-functioning autism. And so I said, yeah, okay, I got it. He said, well, he was Sheldon Cooper. And he said, kid was brilliant, genius. But he came in and he had a diagnosis of severe depression. he also was diagnosed with depersonalization, derealization. He was possibly psychosis. And then he went to a doctor who diagnosed him with Lyme disease and told him that the Lyme's was eating his brain. And then he was told that he had, chronic inflammation and, he had all these different diagnoses. And this kid was 28 years old and he believed like his life was over. That was it, because he took things very literally. Mm-hmm. And he was like, and he said, so I'm talking to the kid and I just said to him, listen, you just have a rusty right brain. And I gave him your book, Disconnected Kids. And he said, okay. And I said, go back and read it. And he went back and read it. He said he came to me like a week later and he came in and he had a smile on his face. And he sat down and he said, I read this book and this is me. Mm. And so I don't have something eating my brain. And I don't have all these diagnostic things. He said, I just have a deficiency in my right brain. And he said, yeah. And the kid said, oh my God, this it changed everything. Yeah. And then the funny thing was the kid said, his father said, let me read that book. And he read the book and his father comes to him and says, this is me in the book, right? So that shows you that when you say it's genetic, it runs in families, but the father didn't have Asperger's, but he had that personality trait. And so that's a perfect example of how all of these diagnoses from all these different people, and they really never really understood it, but Leslie was, he got it and he knew my work. And he was there to be able to say, no, this is just a kid with a right brain deficit.
But so many people get online and say, that's too simple of an explanation.
Yes, of course.
Okay.
Yes.
Okay. And for these kids, these adolescents, because I've had those cases over the years where you have these 15 and up, 15 to 25-year-old. It's such a relief for them to realize that they, like, I remember my assistant that works in my office now, and when she's 24 and she at 19 was brought to me by her mom, and she's like, "You're our last hope. If you can't help her, we don't know if anybody can help her. We've tried every type of medication under the sun to control her OCD." And they got to the point where they couldn't even keep soap in the house because she would wash her hands so excessively to where her skin would just literally peel off her hands. And then she just had these phobias, and she'd have to wear gloves nonstop because she would never want to, get her hands dirty either. And so, and as I went through her case, I mean, she was originally diagnosed with cerebral palsy early on in childhood, but then, right after that came the ADHD diagnosis, a tic diagnosis, an OCD diagnosis. And I remember talking to her mom and saying, listen, at the simplistic level of this, your daughter just has a very, like Leslie said, rusty kind of right brain. And if all we do is just start treating into that right brain over and over and over, I feel very confident that we're going to change your daughter's life. And so we did. And we spent about 9 months working on her. And after that, she was so thankful that she says, do you think I could come just hang out in your office and help you with some other patients? And I said, sure. And to this day, she's been helping me treat patients.
That's awesome. That's a great story. And that's a perfect example of it, right? And I remember when I first started really getting in and doing research into this stuff, I started going to I remember there was a conference on ADHD, and it had some pretty big name people in the psychology and ADHD world. And I went, and I really, I knew functional neurology, I knew neurology, and I knew the brain because that's what I've been doing, but I really didn't understand that, how it related to these, neurobehavioral issues and the ADHDs and the autisms and everything, because we had never gone there before, right? We were just looking more at the physical or neurological signs and not looking at the cognitive. And so I remember going there, and I remember two psychologists literally got almost into a fist fight over, they looked at a case and one was saying it was ADHD type 1 and the other one was saying it's ADHD type 2. And they were arguing over it and like back and forth. And so finally, got to answer questions. And I said, this is actually a question for either one of you, okay? Can either one of you tell me what is actually happening in the brain neurologically in ADHD type 1 or type 2? What is the difference and what is actually happening? And they looked and they were like, they looked at each other, they looked at me and they were like, I don't know how to answer that question. They didn't even think about it. Mm-hmm. All they cared about was getting the right diagnosis. Mm-hmm. They didn't understand what the diagnosis meant. There wasn't a different treatment as far as they were concerned, really. But they just were so adamant about, and that's that left brain. I need to get that right diagnosis and give it the right label. And then my job's done. I gave you a diagnosis and that's it. But what am I going to do about it? Oh, there's nothing you can do about it.
Yeah.
And that's what they're told. But I remember thinking that, oh my God, these guys are arguing over the difference between AD. Neither one of them knows what it is.
Yeah. And that's what we're seeing now more than ever. I mean, again, because of the TikTok and the Instagram, there's just these arguments that are happening, and you see people and maybe they're bots and maybe they're real people, but the reality of it is somebody will get there and go, no, it's this, it's Lyme, it's this chemical or whatever it is. And you just sit back and go, you're all wrong.
Yeah. Okay? I mean, so many times I'll put a post out there about something, or, a parent will put a post on my Instagram about, miracle of their child or something. And then someone every once in a while will jump on and like in the functional medicine world and say, it's all about the gut. And if you're not doing that, you're not doing anything, right? And all of that. And that's the root cause. And that, so kind of negate everything that's been said or anything. And obviously I'm not even going to bother arguing with them because it's not worth it. And it could be a bot that I get into an argument with. But it's just like, and just the arrogance of somebody going on my Instagram. And every once in a while I search and I go, who is this person? And they're like some, let's say, low-level practitioner maybe, or maybe not any. And they have maybe 200 followers.
Yeah.
And they've been doing this for a year, or they're a student, like a nursing student, and I'm like, you have no idea what you're talking about, and the arrogance of coming onto my Instagram and just telling me I'm wrong, right? Saying no, you're wrong. Okay, you have no clue what you're talking about, but. Again, we live in this world where people can do that, and they live behind the curtain of the protection of anonymity, and they're on this social media, and and they just can say whatever they want to say whenever they want to say, and there's no consequence for it.
Yeah, and I think in closing, there's a couple things I want to say here. Number one is that you've been doing this now for 30 years. I've been doing this for...
I hate to admit it, Peter, but I'm actually almost at 40.
40, okay, all right. So you're at 40. I just hit the 20-year mark, okay? So there's 60 years of experience now between us, okay, doing this. And the amount of cases that we've done, okay? You and I were part of a company that we built together that's still going strong.
Yep.
So strong that US Today just did a huge article on their new outcome study, okay, that showed... And again, this was... same protocols that you've instituted. They really haven't changed the protocols from the moment you founded this company. Okay, you did some of the early research with Dr. Leisman on the 4,000 or 5,000 cases that we did, and then the current leadership group has done more studies, and so you take those cumulative.
That I always encourage them to do.
Right. And you take those studies in the accumulation of all of them. There's an end value there of about 30,000, 40,000 cases in those individual studies, okay, over a 15-year span, okay? I want somebody to come on our show and tell me that they have any data that can rival that data, because there's none. There's absolutely none.
Nope.
Okay? And to the sophistication of that data, okay, that's done. Okay, we're not just talking about looking at one area of functional gains. We're talking about all the different ways that you built that to look at the sensory system and the motor system and the cognitive aspect, the changes in behavior, the growth in socialization. There isn't a stinking organization that can do that. And
most of those tools are standardized and normed.
Exactly.
And so they've been validated as valid objective tools.
Yeah. And so that's the thing, is that when practitioners or individuals want to, say things about what we do, it's like, what is your end value? Okay. Have you published a paper? Have you or your clinic been part of the data that was published? Okay. I remember somebody once said, "Well, you hadn't published anything yet." Yeah, but my centers were the centers that were in those original studies, so I know what happened to those kids. Okay. I was part of the Harvard study. I know what went on in that study.
Yeah.
Okay. So the reality of it is that we continue to show objective, measurable changes time and time and again. And the biggest thing is the reproducibility. It's not necessarily about you. It's not necessarily about me. It's about the methodology that you created that can be taught and reproduced
Yes.
over and over and get outcomes
Yes.
that are significantly different than anybody else.
Right. And it's not about the tools. It's not just about the tools. It's not about a laser. It's not about a vagal stimulator. It's not about a specific vitamin or supplement like everybody want to look at. That one thing that's going to be, the holy grail that's going to give all the answers. And you can have the greatest tools in the world, but if you don't use them with the right operating system, if you're not actually directing them in the right way, they can actually make someone really bad or make them much worse. So that's why the understanding that there's a huge integrated system, and it all comes down to the brain and the nervous system. And most people simply have no idea how that system works, and so they really can't comment on it. And so, or they'll dismiss it because they don't know anything about it. But that understand that you could spend years chasing and putting out fires and managing symptoms and never getting to the root cause. And if you're not really understanding and dealing with the brain and brain development, because the root cause starts in brain development, if you're not getting to that, then you're probably not getting to the root cause. And so therefore you're going to keep on, fighting fires and running out there and spending all this money and not really, and just running in place, not really going anywhere.
Yeah,
And
not only
that's
spending
what-
money, but losing time.
Yeah,
Okay?
and that's what people don't want. Yeah, and losing time is a big thing because I see it so many times. I've had a couple of patients, adult patients, that their parents have brought them in and suffering from, either severe OCD or severe depression and you go back and look at their history, and their history was as one of the kids that we work with.
Yeah.
One was clearly dyslexic, right? Mm-hmm. And now severe depression. And it's just at this age, at 30 years old or 35 years old, you can't you can't make them do anything.
Yeah.
Or you get to a teenage kid that is just going to say, no, I'm not going to do it. Yeah. And maybe even get violent. And now you've lost that window. Yeah. And people say, can you help an older kid? Can you help? Yes. Does your model work with them? Absolutely. Yeah. The only problem is, are they going to cooperate? Because if they don't when the child's young and they're 2 and 3 and 5 and 10, the parents can control what they do and they can do it, and we can make really big changes. You get to a certain point and no one's going to make them do anything. And unless they buy in, unless they understand it. So, that's why you really need to look at the big picture. You need to get somebody that understands the whole system. I think more and more in all of healthcare, we're going to need to work towards people that have an understanding of the brain and the nervous system and its role in overall health, in autoimmunity, in digestive issues, in cardiovascular issues, and everything.
And that was really the basis of that article in the U.S. Today, was really about the impact that your work has on overall brain health. Okay. So I think that's where, so for our listeners out there, and if you are confused and you're muddling through this storm that you're in, first get the book.
Yeah.
Get the 3rd edition Disconnected Kids book. Start there.
Yes.
Listen to our podcast. We are lecturing again. So these are the things, and then just reach out to us.
Yep. And we're there. And, for me, obviously, it's at drrobertmelillo.com. Where can people find you?
drpscire.com. Yep.
And, you can go out and lots of times, even on Instagram, I ask questions directly. People put questions to me. I have almost 1 million followers, but I'm always looking at it, and people would put out questions, and I'll reach out and answer. And people are always like, "This is you answering?" I'm like, "Yeah, I do it all the time." So yeah, reach out, ask questions. If we can, we'll get to it. Keep listening. We got a lot more to come, and even more practical information and everything. But thanks for paying attention again today. This has been another great episode. I think we talked about some really cool, important things, and we'll see you again soon. Thanks.